Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Hydrocele. Hydrocele, first we look at the vaginal hydrocele. So this is the most common type, so it's MC. And the primary hydrocele is a collection of the fluid. It's a collection of the fluid in the tunica vaginalis. So they can be large, they can be dense, as well as the testis, it can't be felt separately. Testis can't be felt separately. Next is the secondary hydrocele. So in terms of the secondary hydrocele, it causes trauma. There is a trauma, the tumor and the epidermal orchitis. The diagnosis here will be the ultrasound. Next is the congenital hydrocele. It is caused by the patent process vaginalis, PPV, and the size varies actively as and the posture. The spontaneous obliteration in 2 years. Next is there is also the herniastomy, and this is if the spontaneous obliteration does not occur. There is a funicular hydrocele. The funicular hydrocele is basically the processes. It is the processes vaginalis. Vaginalis, it is patent up to the top of the testis, and it shuts it from the tunica vaginalis. Next is the infantile hydrocele. Infantile hydrocele is the process vaginalis. It is patent and it is up to the deep ring. Then it does not communicate with the peritoneal cavity. Next is the hydrocele. The hydrocele of the cord and the canal of the neck. So then this is the obliteration. This is obliteration of the upper and the lower parts of the processes vaginalis. Then the cystic swelling goes down where the testis is pulled. So cystic swelling, it moves down and the testis is pulled. This happens in the hydrocele of cord and the canal of neck. And that's what the cystic swelling, it moves down. Next, looking at the bilocular hydrocele. So in the bilocular hydrocele, there is 2 sacs communicating near the neck of the scrotum. So what is the hydrocele? The hydrocele of the hernial sac. The hydrocele of the hernial sac, the neck of the hernial sac is closed by the adhesion. So there is adhesion of the momentum. Next is the retention. So there is retention of the fluid, and this is secreted by the peritoneum. The peritoneum of the hernial sac. So the types includes the congenital hydrocele, the funicular, the infantile, the encysted. Next, the vaginal, as well as the bilocular, the hydrocele of hernial sac. So how to treat this? The treatment will be the Lord's plication of the sac. Then comes the medium. The medium will be by the small is the Lord, the small Lord, the medium Jacobis, the Jabolis, and then comes the large. Large means it is an excision of the sac. To learn and grow daily like this, please do subscribe.